we are really excited today to have Judy Johnston with us today. And I'm just going to do a short, her bio is really fun and really cool, but I just want to do a short bio and then we're going to go ahead and let her and turn it over to her. Judy's a registered and licensed dietitian. She's got 18 years of clinical and administrative dietetic experience in hospitals. I love this. She joined the Bureau of Health Promotions at KDHE in 1989, and she was the creator and director of what's called Kansas Lean, Leadership to Encourage Activity and Nutrition. Love it when those acronyms work out. They had over 800 community partners. Kansas Lean was a community collaboration with sector-specific work groups. And so they're like commodity groups, food service, early childhood and education, schools, seniors, and youth organizations. She joined the extension faculty at K-State University in 1999 as the co-pilot of a NIH-funded R01 grant, which was Youth Environments Promoting Nutrition and Physical Activity, otherwise Healthy Youth Places. So she did in 16 different middle schools across Kansas. Her current work includes community assessments in rural communities, and so we have the opportunity to see all the assessment that she did in Grant County. She completed assessments in 6 rural counties from 2017 to 2020. Her innovative community assessment process is an option for newly funded pathways to healthy community grantees funded by Blue Cross and Blue Shield. And 11 counties have already expressed interest in the CHA process. So we have some really great stuff she's already done for us. She's a cancer survivor, and she works to provide survivorship education resources to both healthcare providers and survivors in rural areas. She works with the United Health Ministry Fund to create and support healthy congregations initiatives in nearly 100 United Methodist churches in Kansas and Nebraska, mostly rural areas. Judy and I talked earlier, and I know Margaret's been in the conversations, but she has a love for rural Kansas, and so she's right at home with us out here. We wish she was with us, and we'd love to do this in person, but today we're doing it via Zoom. This is how that goes. But someday we'll have her out here in person and we'll talk more about that in our next kind of time with her. So Judy, it's all yours.
Great. Thank you, Troy. I'm going to go ahead and share my slides. I wish I was out there too. The hardest part for COVID for me has not been able to be out in the communities, because that's the part of my job I love the most. So I'm going to share some of the data from the Grant County assessment that we conducted back in 2017. And we'll kind of go through that. Let me see if I can, there we go. So we'll talk a little bit about what the process is and why Grant County opted to do it. And then I'm going to share the demographic data and the data around beliefs regarding health and wellness. And then for first 2 sectors, and then we'll talk a little bit about next steps. So why did Grant County want to do a community health and wellness assessment? Well, it was really to assess knowledge, beliefs, perceptions of health and wellness resources among Grant County residents. And if you think about traditional community assessment, they tend to focus just on problems. And I think it's really important for communities to look at what assets are in the community and what are the needs of the community, in the words of the community members, as opposed to just thinking of it in terms of medical needs. And so that's how this is structured. It provides data on residents' needs and wants that can be used for community planning and for grant applications. Rural communities tend to only have regional level data or state level data. Therefore, they're at a disadvantage when they apply for grants. But if you have local data, it makes it so much easier for you then to leverage resources. And so that was a real key issue for me when I proposed this to Grant County. It's also important to use this kind of a process to increase residents' awareness regarding what opportunities already exist, as well as keep them in the information loop as you develop new opportunities for health and wellness. And then last but not least, this process uses what is called community engaged research, which means I'm not a researcher who swoops in and collects data and leaves and you never hear from me again. This involves the members of your community. They're involved in the deciding what questions to ask. They're involved in doing the data collection. So they're asking people they know, work with, go to church with, go to ball games with, have kids in school with, and so on. Other people that they know are asking them to complete surveys, and people are much more likely to complete a survey if people that they know or people that they know are from their community are making that request. So it engages people both through the surveys and the focus groups. So it really belongs to the community. The data I'm going to show you today is your data. It doesn't belong to me, it belongs to you. So the process we used, we were looking at one survey per household. Any adult in the household could complete it, or all the adults could complete it together. We collected some demographic data, and we can slice and dice data any way you want. And I'll show you the ways we looked at grant counties. We look at health beliefs, and the reason I ask these questions, and I'm going to show those to you today, is as you start thinking about messaging around the things that your coalition wants to do, it's important to know what people believe are the factors in their health and wellness. And so that's why we ask health belief questions. And then we looked at 8 community sectors, and I've listed them there: healthcare and public health. We're going to talk about those data today. K-State Research and Extension, I think, is a health and wellness sector because there's such a huge health and wellness resource in most communities, in particular in rural communities. Community environment looks at those typical public health environment kinds of things like water and air quality and so on, but it also looks at built environment. Are there opportunities for healthy food, accessing healthy food? Are there opportunities for physical activity? What are the regulations and the policies and the practices around tobacco use and exposure? Those kinds of things. So it's a pretty broad category. Those 4 categories, those questions are answered by everybody who answers the survey. I say they're answered. They're invited to answer those. Anybody can refuse to answer any question they don't want to answer. It's fun. Then you'll see I have 4 additional sectors that I have asterisks on: work sites, early child care and education, schools K through 12, and faith communities. There's a preliminary question on each of these that says, do you have somebody who works in your household who works outside the home? Do you have a child in early child care and education? Do you have a child in K through 12? Are you or any member of your family active in a faith community? If they say no, they don't even answer those. So not everybody answers those questions. So, well, let me back up and say the process, and I thought, there it is. We used Baylor interns. They happened to be working. Benjamin Anderson was the hospital administrator in Kearney County and had a long-term relationship with Baylor. And so students came every summer, and we leveraged some funding to pay Baylor interns a large number the summer of 2017 to help with data collection both in Haskell County and Grant County. And a number of their interns were bilingual, which was really, really helpful. So we recruited them and trained them along with some community champions and community volunteers. The folks we trained tended to represent work sites or other organizations in the community. So there was a number of folks that we trained to do the data collection and to kind of champion the project. I took care of all the human subject stuff. There's always a question when you're doing research. I have convinced the human subjects people at KU that this is quality improvement, which it is, and so it makes it much more simple, but I do take care of that for you. But the students really coordinated the data collection with the community champions and, and the trained volunteers. So there were volunteers spread out through the community. The survey is anonymous, and it's very intentionally anonymous. So the protocol, it was a paper and pencil survey, and the protocol was such that people completed the survey, folded it, and the volunteer who was collecting it had a big manila envelope, and the person who completed it didn't even hand it to the volunteer. They put it in that envelope themselves. Did I disconnect? But I'm back. I'm not sure. We have this verification form. Let me try this again. There we go. And the verification form allowed them to give people who completed the survey a $10 gift card. The survey is about, if you answer all 8 sections and the demographic and health questions, health beliefs questions, it's about a 20-minute survey. And we found that a $10 gift card was enough that people would take the time to complete it. But we also wanted to protect the volunteers so that when we issued gift cards, they could verify that they gave them away. They didn't put them in their pocket. And so the form, people just initialed it. We did not want signatures. They initialed it. Yes, I filled out the survey and I got a gift card. And we wrote the actual street address of the survey. And that was completely separate from the survey, and it was completed and folded and put in a separate envelope. So we never connected addresses with surveys, but it allowed the students then to track addresses and look at where did we get surveys from. And that was important because you want to be sure that you cover all areas. I'll give an example. In Kearney County, the first county we did this process in, we use large maps and push pins, and we realized as we were kind of wrapping things up that there was a huge section on the north side of Deerfield where there were absolutely no surveys. And so we sent the students out there and discovered that it was a largely Spanish language community, most of whom worked at the meatpacking plant just over the county line in Finney County, the big Tyson plant. Fortunately, I know the HR director, so I sent the students to talk to the HR director, and she said, this is really important that their voices are heard. And so she actually pulled up the addresses of all the people that lived in Deerfield and said, if you would like to complete a survey and have not done so, you will have bilingual people here to help you on these dates and times, and you can leave your workstation and go complete a survey. It was huge, and we collected a ton of surveys that way, and we're able then to say, okay, we did get this population represented. So those maps became really important, and the students really took care of tracking that. And I know in Ulysses, there were a number of trailer parks where they didn't have anybody, and they went out, they partnered with high school students who actually knew people who lived in those areas. And this is, when I say community engaged research, this is a great example of it. The Baylor students partnered with high school students who then went with them to the trailer park and were able to collect data from the people who lived there. We wouldn't have been able to get it any other way. That's the advantage of community engaged research. We did all the data entry and analyzed it. We have a statistician who takes care of that. Okay, let's see if we can get the slides to go. So I got those out of order. So we ended up with a total of 1,328 completed surveys. 62% of the houses in Ulysses completed surveys. And if you looked at the whole county, it was 49% of all the households in Grant County completed a survey. We set a pretty high goal of 80% of the urban areas, and we've been able to meet and exceed that in a couple of communities, but it's a high goal, but we really want to try to get as many people as possible. 62% is a darn good percentage. So let's look at who completed the surveys. Excuse me. I've got so that I can see. As you can see, mainly women, and if you've done surveys or if you have a spouse in your household, you know that it's usually the women who answer the phone, the women who answer the door, and the women who are willing to fill out surveys. And that was the case in Grant County as well. The mean or average age of people who completed surveys was a little over 46 years of age. But as you can see, most people were willing to answer that question. Total household income, you can see we have a real diversity. Whoops. We have a real diversity there whoops. My slides are kind of going a little weird on me. There we go. I don't know why they're moving forward. I apologize for that. But as you can see, we have the whole range of incomes. The average median income according to the census was, I think it was like 57,000, and I can't see that. right now because I've got, there it is, 54,919 was the median household income in 2017. But as you can see, we have a really diverse group. So we didn't just collect data from one socioeconomic group or another. We ask about employment, and again, the vast majority were improved. 84% were employed. Only 14% were not employed, and that's a combination of people who were unemployed and people who were retired. We have ethnic diversity, however, not as diverse as the county. 26% of the respondents were Hispanic or Latino, and yet the whole county in 2017 was a little over 46.5%. And you don't have a lot of other diversity in your county. It's primarily white, Hispanic, and white non-Hispanic. So like I say, you did have some diversity, but not as great. And the reason it's important to know that is that as we begin to talk about follow-up data, it's going to be really important that we hear from the Hispanic and Latino community as well as the white non-Hispanic community, so we make sure that we're capturing everybody's input. We ask about insurance status. The vast majority, 69%, had private insurance. Most of it was through employers. 20% had Medicare or Medicaid, and then we had some folks who didn't know, who chose not to answer. Only 1% in 2017 were uninsured, which was good. That probably has changed in light of COVID. I'm going to stop. Any questions about the demographic data before I move on?
No.
Okay, let me share some data about the health beliefs. And what we did is we offered some well-accepted definitions of health and wellness. Health and wellness is the lack of disease, kind of a very basic, single-minded approach. Health and wellness is a state of best physical, mental, and social welfare, and not merely the lack of disease. Health and wellness is an active, lifelong process of becoming aware of choices and making decisions toward a more satisfying life. And health and wellness is a state of being strong, undamaged, and whole in body, mind, or soul, especially the state of being free from physical disease or pain. And we asked people which one of these definitions they prefer. And as you can see, only 2% looked at that very basic absence of health and disease. And the three that were more active were pretty consistent, although 33%, the largest percent, not statistically significant, but really saw it as a process of making choices and changes, which from a community standpoint, where you're thinking about offering opportunities and making changes in what's available and educating people more about the availability of health and wellness resources, this is really good news for you. Only 6% said they didn't know, and 2% said they chose not to answer. So again, this is really good news for Grant County. Now, we did also break it down by ethnicity, and the red bars are white non-Hispanic, and the blue bars are Hispanic, and then these percentages here at the end are the differences between them. And you can see that one that was most popular, the state of being hale and sound, or second most popular, I should say, was most preferred by the Hispanic community, with the one that overall was most preferred, the health and wellness as an active lifelong process, was number 2 with the Hispanic community, and the optimal health and wellness again was number 3 with the Hispanic community. Again, not huge differences between them. Among the non-Hispanic community, that process one, well over a third of folks preferred that, but again, the differences were not very significant, or were not significant. Only 2% of both the Hispanic and the non-Hispanic populations preferred the absence of disease, so that's good. It is important to note that 10% of the Hispanic respondents said, I don't know, which again, when you're developing messages, it's important to keep in mind that those terms, health and wellness, may not have a lot of meaning for everyone. And so especially if you're dealing with the Hispanic or Latino population, you want to be sure to ask that question, what does it mean to you? Because 10% said, I don't know. That's not a huge percentage, but it needs to be noted. This is kind of a busy graph, but we ask 3 questions about what influences your health. The environment where I live, learn, work, play, and pray influences my health. My personal decisions and choices influence my health, or healthcare is responsible for my health. And the way we've divided this, the left column is white non-Hispanic, the right column is Hispanic. In all 3 cases, the blue says, I totally agree with that statement. The red says, I partially agree with that statement. The green says, I disagree. And the purple says, I'm really not sure. So let's look at each of those. Environment. And again, when we're thinking about environment, we're using that term to say the places where people live, learn, work, play, and pray. Those environments, excuse me, influence my health. And as you can see, an overwhelming percentage, in over 90% of the white community, almost 85% of the Hispanic community agreed or partially agreed with that. When we talk about the role of personal choice, personal decisions, again, very high percentages, well over 90%, excuse me, of the white respondents, non-Hispanic respondents, and about 85% of the Hispanic respondents. It's not as clear-cut on healthcare is responsible for your health. And again, this is important when you're doing messaging. The data nationally says that the healthcare system is only responsible for about 20% of our health. And so it's important to know whether people think the healthcare system is more responsible than that or not. And if you look, it's basically right at 60% agreed or partially agreed with healthcare being responsible for their health, with more of them partially agreeing. But there's a significant number of folks up here that said, I disagree with that, which tells you have some people who are thinking outside the box, who aren't thinking of just depending on traditional healthcare. Almost 36% of the non-Hispanic and 30% of the Hispanic community. So you've got some folks who are thinking outside the box, who are already thinking about the role of environment and personal decisions. So this is a busy slide, but it really has some important data in it. So I'm going to show you now data for a couple of the sectors. We don't have time to go through all of them today. We'll do some additional presentations down the road. But just so you know, the orange bars are health and wellness resources that people think or know are available in Grant County. And what the survey offered was a list of possible resources. And I developed that list from looking at the literature, from looking at websites and so on, and saying, here are things that in theory could be available. And we asked them to mark things that they think or know are available in column 1. And then in column 2, if it is not available, but they wish it was, mark that. And those are shown by blue bars, things that people say they want or need to be available. When we look at the ethnicity, again, the red bars are the non-Hispanic and the blue bars are Hispanic, and the label at the end shows the difference in percentages. So let's look at healthcare sector. And again, a busy slide, but if you look at this, this gives you a hint at all of the things that were on the list, everything from emergency care down through chronic disease care, and they have the option to write things in if they want to. And what we do is we analyze the data and graph it, so the things that people think are most available are going to be at the top. Or let me rephrase that. Most people think are available are at the top, and the things people don't think are available. Well, how do you use these data? You look at it and say, well, gosh, you know, we do have a diabetes management program at the hospital, and obviously not very many people know about it. So it's a red flag for you that, gee, we have some resources in our community that people are not aware that they exist or aren't aware of how to access those. So this bar, these orange bars, are things that you're going to use and really look at that. Do these things actually exist? And people not know that they exist or how to access them. And that tells you those are kind of the low-hanging fruit. What are some things that you can market that already exist that are easy wins? This one looks at the blue bars are what people wish was available. And again, we arrange it by priority. How many people said it was a priority? And you can see, you know, you get up into weight management and dementia and so on, but there's always 4 to 6 usually here at the top, and then there's a clear break. That's not to say these others are not important. You're never going to lose any of those data, but these up here at the top are the ones that we're going to take forward and actually take on right away. These are things we're going to have focus groups about and really talk about. And so as you look at these, again, weight management, dementia care, early detection works is the program for uninsured women, diabetes prevention, diabetes management, substance abuse treatment, breastfeeding support through a special clinic or by specially trained experts, and so on. You can look down the list. There's a whole lot of stuff there. And we will, Troy, I'm going to ask you to send the slides to everybody so they can look at them at their leisure, because this is a lot. So here's where we actually look at what people say they want. And if you look at the top, high-risk obstetrical care is up here, and there's an 18% disparity between the people that are non-Hispanic and the Hispanic people who want that service. So you want to look at that and say, okay, what is available, what can be done, and who do we need to be sure that we educate about what is available. As you look at breastfeeding, the breastfeeding clinic and breastfeeding support, the Hispanic community seems more tuned into this, and I found that in other communities as well. And we actually worked with a couple of counties, and including Grant County and Kearney County and Haskell County, and developed a virtual breastfeeding support network with a colleague of mine here in Wichita. Do you look at physical therapy as more than non-Hispanic? Chronic disease management, it used to be called Kansas Optimizing Health, but again, it's a need that seems to be greater in the Hispanic community. So you can, I'm not going to go through all of these, but as you can look, most of the differences are in that 8 to 10% range, but there's a few here at the top that are significantly different between the Hispanic and the non-Hispanic communities. And so it's important to look at the data that way as well.
Judy, this
Yes.
is, and when you guys did the survey, did you use the exact terms here to the population, or did they explain and you know what?
We actually had some explanations in them. So where, for example, early detection works, we said in the survey in parentheses, free mammograms for uninsured women. Each community gets to edit the questions. And so language is important. And so terminology is important. And this was only the third community that we worked in. And so a lot of editing didn't happen in Grant County, but it could have happened. And I know we're working now with some other communities that are doing a lot of language editing. But not only the language we use, but additional items. For example, when we went to, I have to stop and think, Wilson County, which is Fredonia and Neodesha in southeast Kansas, they felt like there were some real issues around domestic abuse and sexual violence. And so they added some additional items, and indeed they ended up being priority items in those communities. So everybody edits them, but the language, if it wasn't clear what it was, we had an explanation in the survey. Does that answer your question? So here is what people needed. Again, looking at the differences between the Hispanic and non-Hispanic. And these particular graphs you'd really use when you think about messaging and targeting specific groups. So kind of in summary of that, because you don't have time to really mull over all of those data during the presentation today, the majority of respondents of all races and ethnicities were really aware of many of the available healthcare resources. In some counties, we found some things that were pretty obvious that people didn't know anything about. So we didn't find that in Grant County, although there were some that people were less aware of. Top needs were high-risk obstetrical care, chronic disease self-management programs. That's things like, you know, COPD and asthma and diabetes and so on. Weight management, coaching, and nutrition counseling was a priority. Dementia and Alzheimer's disease care. Diabetes prevention and management was broken out in addition to the chronic disease. And then that early detection works program, which, like I say, is free mammograms for uninsured women. We did find that Hispanic respondents had greater needs. The same things surfaced, but they had greater needs and wants. But they also ask more frequently for breastfeeding education and support. So I'm going to stop and see what questions you have about the data. Is there anything that surprised you or confirmed what you thought you knew? And what other things do you think you would want to know about the healthcare sector?
Yeah, so you can unmute and mute yourselves. So if anyone has some specific questions, this would be a great time.
I thought the example you gave about the domestic violence, the community that asked about that.
Yes.
If we were to do future surveys here in Grant County, I think that would be a really excellent addition to make.
Great, thank you. And we can either do it as a survey, or it could become something that we talk about in focus groups. And we'll talk about focus groups here in a little bit. That's a great suggestion. Thank you. Other thoughts?
So I'm wondering, Judy, because of the breastfeeding, that focus on wanting more breastfeeding education and support, I wonder if that might be one interpretation. Could be because of the age of the Hispanic population, which in Grant County I think is a little bit younger than the non-Hispanic or white population. And so I was thinking about, yeah, that would make sense. And then figuring, I really appreciate your idea of messaging, and I'm kind of mulling over what part does the coalition have to play in messaging, and how can we already support what's already going in a way that makes sense. So great. I mean, it's great thinking for that.
Yeah, and our experience has been in all the counties that have significant Hispanic populations, they want more breastfeeding support and information than the non-Hispanic. That seems to be related to ethnicity. And you're right, it may be that it's a younger population as well. Okay. Well, in the interest of time, let's look real quickly at the public health sector data. Again, the same kind of colors and so on. So these are things that people think or know are available and things that tend to be available through health departments. And again, you can see that the percentages are fairly high of people who know or think it's available, number of items. If breastfeeding information is available through the public health system, only 30% of people think it is. When you look at Healthy Start program, and this is an example of explaining to educate and support pregnant women and families with babies up to a year of age. So some of these things are things that we traditionally think are available, but then you get down into things that are perhaps less. It's interesting that although health departments all are doing environmental health monitoring either locally or at the state level, it's something that most people aren't aware of, and it's kind of like most monitoring and a lot of things in public health. If they're working, you don't notice them. And so it's not surprising to me that only 27% think it's available. Breastfeeding support through a special clinic at the health department, breastfeeding support by peers. People don't think the breastfeeding information is very available. So let's look at needs. Again, the top need was that breastfeeding support, looking for people that are specially trained in that, or through a clinic at the health department or by trained peers. So those were the three top things that people wanted. And then you get down from the public health system. Again, we're looking at these sector by sector. They were looking for family planning information, that healthy start information, and then it drops. You can see where these natural breaks are, and that always happens. And then you get into the STD information and TB and some of the other kinds of things. Again, looking at the differences between the non-Hispanic and the Hispanic, the differences tend to all be, of these, tend to be in that 10 to 11 range up here on these top ones. The differences aren't real significant, but again, if you're talking about doing some work, for example, in the breastfeeding, you want to look at the differences and what specifically are people looking for. Here you'll see that the difference was 9%. People are wanting some printed information more than they're wanting the support by peers, and yet the Hispanic population is wanting more than the non-Hispanic population. So again, these are charts or graphs that you're going to want to study a little more as you think about how to proceed, how to target initiatives, and how to message. So this is, again, what people want or need. And the differences are a little greater than in what they think is available. But you'll see all of the needs and wants are greater in the public health sector for the Hispanic community. So again, trying to summarize that a little bit, that, majority were aware of public health resources, but the Hispanic respondents were less aware than the non-Hispanic. The percent of respondents requesting additional public health services was lower than the healthcare sector requests, which, we can interpret two ways. One is that people aren't familiar with the public health department and what could be, and therefore they aren't, requesting additional services of them, or it may be that they simply don't feel like that's their best resource. So the top needs and wants: environmental health monitoring, which, because you're an agricultural state or county, we find a lot of times that people are concerned about pesticides, air quality, water quality, and so on. Certainly breastfeeding education and support came through loud and clear. People are looking for resources for family planning in the health department, that Healthy Start program to support families with babies and up to a year of age, and then the STD treatment and testing. The Hispanic respondents were more likely to request the breastfeeding information. They were more likely to request the environmental monitoring, TB testing, and follow-up health education than the white respondents. So I'm going to ask again what questions you have, if anything surprised you or confirmed things you thought you knew, and what else do you want to know about the public health sector?
Margaret, again, I have, I'd just like to know, because have you contacted or shared this data? And you may have said it and I missed it because I was in and out, but with like say Genesis or those other organizations, are they aware of this?
Margaret, I'm glad you asked that question because I forgot to say that. Back in 2017, I did have a meeting with a group of community leaders. We had it at the extension office. There were people from the businesses in town. There were people from elected positions, from healthcare, from the extension service. So a kind of a cross section of community leaders, and we shared all of these data with them and attempted to schedule focus groups as a follow-up to discuss some of these higher priority issues in detail. And I scheduled the focus groups. I reserved the space. I sent letters to everybody that had provided me the information to send them letters and said they wanted to know when focus groups would be held. I made arrangements with the Chamber of Commerce to take reservations for focus groups. I had one person sign up for one of 16 focus groups. So we didn't hold them. But yes, it was shared back in 2017. Unfortunately, I don't think those people shared it any further, even though I provided them hard copies and also emailed them all the data for all the sectors. I don't think it was shared any further.
One of the things that I've come across, I've been working on this past year, was getting connected to regional service organizations. So even though they're not based in Ulysses, there are still services that they get accounted for covering Grant County. And so I've been having some struggle, or, not necessarily being, some are receptive, some have just, even though they've been informed. And I know that we need to, I was trying to promote, Impact Ulysses. We have a coalition, and just hearing some responses of, well, we're just understaffed and whatnot. And so it's just trying to make sure. That's one of the things I'm concerned about, is making sure that just because they're not based there, they still need to offer services if they say they are. So did you touch base with people that were outside of Ulysses as organizations, or was they just there, the ones that are?
The people, it was Ulysses, and there were some elected officials that were at the county level. I'd have to look if I still have those lists of people. There was a gentleman in Ulysses who owns the pharmacy, who kind of led the effort to, and I can't remember his name off the top of my head, but he kind of led the effort in Ulysses and in the county. The extension agent, and I don't know if she's still there or not, she actually is the one who reached out and invited people to that meeting. And there's a meeting room at the extension office that was completely full of people. But so I think it was county and local people. I don't know that it was people outside of the county. And as I said, these are your data. And so once the county has the data, I can assist in any way that you want to be assisted. They didn't want my assistance at that time. Hopefully that's changed. Other questions or thoughts? Great questions, Margaret. Thank you.
Yeah, I really appreciated the idea of, like you said, some of the things that we might want to have focus groups on and think about really highlighting or impacting. And so, I mean, I put a pin in a couple of those for myself, and then taken some notes. And because I know that, like you said, the focus groups would be really powerful, especially, I mean, it sounds like the breastfeeding is something we can really do. And then also, even if, especially now that everything has kind of gone virtual, they don't have to be actually in Grant County, but if they are, boy, let's highlight them. And if they're not, let's find other ways to really bring that information. So the breastfeeding is one that sounds like that could be a really neat niche and a kind of a marching orders for the coalition.
Yeah, I agree. We have a lot more data, and because there's a lot, Troy and I and Margaret and I kind of broke it up a little bit. I'm thinking we might do another one. Again, 2 more sectors that everybody answered: the K-State Research and Extension and the community environment folks. And then do a 3rd presentation where you can look at the ones that not everybody answered: worksite schools, early child care and education, and faith communities. Early child care and education is often a real priority in rural communities because it just doesn't exist. And that impacts the ability to recruit and retain people to work, especially in hospitals and schools and so on. And I know in Haskell County, that became a huge priority. It was a priority in Kearney County as well, because, you know, trying to recruit physicians to the hospital who had children and there was no childcare available, or nurses and other healthcare professionals to work in the hospital, or teachers to teach in the schools. If there's no childcare, it's really difficult to recruit people to your community. So those are things that we can do additional data presentations, because we have all of it. And then the next step would be focus groups. And focus groups are just structured discussions around specific topics. And we basically take those top items and we can add to those. And for example, you know, to kind of drill into what's going on around domestic abuse and sexual violence and so on. But it's an opportunity to find out what's gone on in the community in the past. You know, has there been an effort? Has there been a coalition? Did there used to be child care centers? Did there used to be walking trails and they haven't been maintained? What's the history? And then it also lets you kind of test some ideas with community members and gather ideas and say, you know, if we're going to address this issue, what does it look like if we get it right? And that's what you do in focus groups. Focus groups last usually an hour and a half. They are limited to about 10 to 12 people. Ideally, they're face-to-face, because then you can see people's faces and their body language. But I have done a ton of them virtually this summer, and they work fairly well. I wish I was bilingual. I'm not, but I have done them with interpreters in the room with me. And we record those, we transcribe them, and then I analyze those using open coding. So what you get back is a list and say, here was the topic. Here's an example of the things people said, and here's the recommendation. So it's a table with information, and you can really get some great actionable steps from focus groups. So I'm going to stop there. Other questions or thoughts? And I think I ran over time a little bit, Troy.
Oh, that's okay. Hey, Judy, would you go back to the slide where we have the broken down to the two? One more slide back. So we want to, when Margaret and Judy and I talked, yeah, one more forward now. Yeah, that one. So we talked about January having a regular coalition meeting, and then in February maybe doing the second data presentation. The presentation number 3, we want to make sure that we invite people from these sectors, because the information is so valuable. So we will kind of get your thoughts on what that looks like, especially those of you who are in schools and early childhood and the faith community, so that we can really get them to the table, because the data was really valuable. We'll give you the whole data set, but the data was really valuable. But if they're not in the room or at the table when the discussion happens, then it won't, you know, as Judy has pointed out, it won't be as valuable. So just to let you know, January will probably be a regular meeting, but and then the data presentation number 2 would probably be in February. March, we're hoping to be face-to-face. And then the presentation 3, but we think we can do some focus groups and stuff like that in between. So.
Does that sound like a plan to everybody? You have this gold mine of data, and I realize that I went through it pretty quickly, so I do want to share all of this with you. But it's just a ton of information that can help you decide, you know, what kind of priorities you want to focus on, and look at messaging and the importance of all the different nuances of the data. And so it's a lot to take in on just a data presentation like this, I understand.
Any thoughts or questions for Judy, especially, you can tell how much we've totally enjoyed spending some time with her. And yeah, it's been really fun. And we've learned more and more. It is a bit overwhelming. when we first got the data, I was like, it was like a fire hydrant. So
Yeah.
that's why we wanted to, but we knew it was so valuable. And we had no idea actually 3 years ago when we all started this together that this was even out there. And in fact, we had a hard time finding anything. So when this came up through the pathway, opportunities with Pathways, wow, it was, so we're excited about that. Any thoughts from you guys or questions or? If not, we'll just do a quick wrap up, and then if there's anything we need to know, Margaret, and then we could just do a quick wrap up and say Merry Christmas and Happy Holidays to everybody.
Kim just put a note in the chat about the domestic violence and that a person comes out of liberal to share information with high schools periodically. That's great. Thank you. I'd be happy to answer any other questions, and I'd look forward to actually getting back into Ulysses. I haven't been there for a little while, so. I lived in the very rural northwest corner of Iowa as a kid, and so I have rural roots, even though I live in Wichita. I grew up in Spirit Lake, Iowa. If you've ever heard of Spirit Lake, it's a little resort town with 5 lakes, Lake Okoboji, Lake Spirit. So I love working in rural communities, and for the last 30 years, most of my work has been in rural communities. So I love coming to Ulysses and Lakin and Deerfield and Satanta and Sublette, all those towns.
Well, that you actually say their names, I'll tell you, that says a lot to me, because a lot of people, you kind of know if they're from out here. So, but now, Judy, thank you so much for the information, and the presentation it's been really good.